From the dawn of civilization, in the vast and often incomprehensible theater of human existence, we have waged a ceaseless battle, a war against the very fragility of our flesh, against disease, injury, and the ever-present shadow of mortality. We seek the cure, the relief, but at what cost? There were darker times, ages veiled in ignorance, where the line between healing and torture was so fine as to be indistinguishable. Before we judge with the certainty of modernity, we must understand their world. A world without germ theory, where illness might be blamed on an imbalance of the four crucial bodily humors: blood, phlegm, yellow bile, and black bile. A concept guiding physicians from Hippocrates to Galen in Greco-Roman times. A world where illness could be blamed on malevolent spirits needing forceful expulsion, or the wrath of gods requiring appeasement, as seen in ancient North Africa with deities like Eshmun or the local Makurgum. Effective anesthesia was absent, pain relief limited to the often inadequate stupor, induced by opium, mandrake root, or alcohol. Their medicine wasn't born of malice, but often of desperate necessity, applying limited knowledge and crude tools against relentless suffering. The result, however, viewed through our lens, was frequently brutal. We will explore 7 procedures, ordered by their perceived severity, starting with interventions that were deeply violating, even if not always immediately lethal. Let us begin in the less glorious depths. Imagine liquids, sometimes simple water, sometimes herbal concoctions of dubious effect, sometimes irritants, introduced under pressure into the rectum. We're not talking about a modern, consensual medical procedure. We are talking about a violation of bodily autonomy, often performed with rudimentary, unsterile instruments, reeds, animal bladders, metal tubes. Beyond the profound discomfort and humiliation, the immediate risk was tangible and terrifying. Violent cramps, acute abdominal pain, the potential for accidental bowel perforation. And then came the aftermath, raging infections like dysentery or sepsis, introduced directly into the colon by the utter lack of hygiene, internal imbalances caused by the very medicines being administered, a cleansing that could easily cost a life. This invasive concept of the purge was pervasive. In ancient Egypt, as far back as 1550 BCE, the elite believed bodily waste, or way du vasi, caused disease, leading to ritualistic enemas, reportedly performed 3 days every single month by some, according to the 5th century BCE historian Herodotus. Pharaohs even employed a dedicated servant, the royally appointed guardian of the anus. Similar practices spanned the globe. 16th century Aztecs in Mesoamerica used enemas to administer specific medications rectally for various ills, while other groups in the region used them for ritual purification, sometimes even involving intoxicating substances. From Egyptian royalty to Mesoamerican rituals, the belief persisted. Internal purity, achieved through invasive means, was key to health. What happens when the cure itself is a hidden poison? Trusting your healer in the ancient world was often a deadly gamble. Heavy metals, now known toxins like mercury and lead, were routinely prescribed. Patients seeking relief from syphilis or even teething pain might instead receive a slow, debilitating poisoning, their nerves and organs ravaged by the very medicine meant to help. Consider the allure of opium and laudanum, used ubiquitously since deepest antiquity, offering blessed relief from pain, only to ensnare the user in the inescapable grip of addiction. And what of remedies demanding a stronger stomach? Applying python bile to open sores, gargling with elephant bile, using crocodile dung as contraception? Beyond the immediate danger of toxicity, picture the gnawing fear when these cures inevitably failed against serious infections or diseases, leaving the sufferer with nothing but wasted time and misplaced, sometimes fatal. This hazardous pharmacopoeia wasn't isolated. Mercury compounds were standard treatments across Europe for centuries. Opium's use dates back millennia. The bile remedies are recorded in traditional Chinese medicine, while the crocodile dung contraceptive appears in Egyptian papyri. These practices reflect a pre-scientific era, lacking toxicology and relying heavily on tradition, where perceived short-term effects could tragically mask long-term harm. Consider the instrument itself, a rigid tube crafted from cold, unyielding bronze. This was the ancient catheter, revealed in archaeological finds from Roman Pompeii. Its purpose? To invade the body and relieve the agonizing pressure of urinary retention. The procedure required forcing this metal implement through the delicate urethra without the aid of modern anesthetics or lubricants. The immediate sensation must have been one of sharp, tearing pain, a brutal violation of sensitive internal tissues. The risks that followed were equally terrifying: permanent scarring, internal injury, and the near certainty of introducing agonizing, potentially life-threatening infections deep within the urinary tract. While the Romans standardized bronze catheters, with writers like Celsus, 1st century CE, even detailing different male and female shapes, the concept was older, with Greek physicians like Erasistratus, 300 BCE, using similar devices. Although flexibility was sought later by figures like Purges Avicenna, 10th century CE, for centuries, this rigid metal intrusion represented the harsh reality of treating internal blockages. Necessary, perhaps, but undeniably brutal. Those diseases which medicine does not cure, iron cures. Those which iron cannot cure, fire cures. So went an ancient aphorism, speaking to the perceived power of cauterization. Applying red-hot metal to flesh seems the very definition of torture, yet its use dates back millennia, found in Egyptian papyri from 3000 BCE. Its most vital, if brutal, application was hemostasis, searing wounds or surgical sites closed to stop bleeding, a desperate measure after major trauma or amputation, but its use extended far beyond emergency bleeding. Hippocrates, in ancient Greece, advocated its use for treating tumors and even hemorrhoids, burning the tissue directly. The searing agony in such a sensitive region, performed on a conscious patient, is difficult to comprehend. Yet, the logic could become even more bizarre. The nomadic Scythians, according to Hippocrates, practiced extensive cauterization on shoulders, arms, and hips, not for wounds, but based on the baffling belief it could cure impotence linked to their equestrian lifestyle. This highlights how an intensely painful procedure could be driven by both desperate practicality and deeply flawed cultural reasoning. The gradual fading of sight due to cataracts meant a descent into darkness for many in the ancient world. Could anything restore the light? The answer was a procedure called couching, a gamble demanding immense courage from both patient and practitioner. The technique itself was terrifyingly delicate, using a sharp needle inserted into the conscious eye to push the clouded lens aside. The potential reward was regaining some vision. The potential cost? Excruciating pain during the procedure, followed by infection, glaucoma, retinal detachment, or complete and permanent blindness. The psychological burden on the patient, facing the needle while contemplating these outcomes, is hard to overstate. Couching is ancient, detailed by Sushruta in India, perhaps 800 years BCE. It spread widely, adopted in the Greco-Roman world, Celsus, Galen, and China. While techniques evolved slightly, including attempts at suction, the procedure remained fundamentally perilous, with failure being far more common than success. It represents a desperate attempt to combat blindness, using methods that were themselves fraught with the risk of causing it. Skulls bearing deliberate ancient holes stare back at us from museum shelves, silent witnesses to trepanation. This practice, drilling or scraping through the cranium of a living person, is the oldest surgery known, dating back 8,000 years to the Neolithic. Imagine the act, the slow, grating removal of bone, vibrations shaking the head, the brain lying just beneath. Why? Archaeology suggests diverse reasons. Sometimes, clear evidence of prior head trauma indicates it was a rational, if brutal, attempt to relieve pressure or remove bone fragments, a practice particularly well developed in the high-conflict Andes. Other times, intact skulls were opened, pointing towards ritualistic motives or attempts to release spirits blamed for epilepsy or madness. Trepanation was global, found from Neolithic Europe to the Indus Valley and Mesoamerica. The Andean cultures, 400 BCE to 1400 CE, became particularly adept, achieving remarkably high survival rates, over 80% sometimes, using techniques like scraping. The existence of individuals who survived multiple trepanations is a stark reminder of both the procedure's horror and the surprising capabilities, or perhaps sheer resilience, found in ancient societies. Even among the brutal catalog of ancient surgeries, one stood out as so feared, so perilous, that the Hippocratic Oath specifically forbade physicians from attempting it: lithotomy, the removal of bladder stones. The condition itself was agonizing, but the cure plunged the patient into the abyss. Held down, fully conscious, an incision was typically made through the perineum. Then came the internal assault. Fingers might probe the rectum or vagina to manipulate the stone. Then, cold metal instruments, hooks, forceps, crushers, blades, were inserted deep into the pelvis, groping blindly to seize and extract the calculus. The pain is simply inconceivable without modern anesthesia. The risks were catastrophic: uncontrollable hemorrhage, damage to surrounding organs, and near-certain fatal infection like peritonitis in a pre-antibiotic era. This nightmare procedure was described by Sushruta in India, 600 BCE, known to Greco-Romans like Celsus, and refined with tools by surgeons like Ammonius, 200 BCE, and Albucasis, 1000 CE. Despite minor changes, its core brutality and devastatingly high mortality rate persisted for centuries. Lithotomy represents the terrifying edge of ancient surgical intervention, a procedure where the patient's chance of surviving the cure was perhaps as frightening as the disease itself. Was it intentional torture? Rarely in motive, perhaps, but often in effect. It was the medicine of necessity, born from the shadows of ignorance. We see the brutality, yes, but through that lens, we must also glimpse the courage of healers who dared to intervene against impossible odds. Their struggles paved the agonizingly slow, millennia-long path toward the knowledge, the anesthesia, and the sterile techniques that shield us today. The echoes of these ancient procedures linger, etched in bone and preserved in texts. They remind us of the fragility of life, the terror of the unknown, and the relentless human drive to overcome suffering. The history of medicine is often written in pain, but it is undeniably our history. If these raw stories from Echoes of Iron have impacted you and you want to keep unearthing the forgotten realities of the past, subscribe and hit the notification bell. Click on one of the videos on screen for your next deep dive into history. We're passionate about uncovering these historical realities, and your engagement helps Echoes of Iron continue to grow and improve. We look forward to reinvesting that support into higher production values, like unique visuals and sound in the future. Thank you for being here.